sticking around to the end. I appreciate it. I'm here today to introduce you to VirtualPhysio, which is an interactive way to help physical therapy patients with their daily exercises. Now, to put this into context, a few years ago, unfortunately, I had to have surgery on my lower back, and because of that, I was in and out of physical therapy for a while. And there was one simple problem that I kept running into basically every day, which was to remember to do the exercises that my physical therapist actually gave me. I knew that it was important, and honestly, I tried to do my best, but as a busy person with about 100 different things to do each day, I quite simply forgot quite frequently. And my PT gave me a sheet of paper with instructions to do the exercises, which appears to be the most common practice right now of prescribing exercises. I see people nodding, they recognize this. For me, in my case, I looked at it exactly once, and then it disappeared into a drawer, never to be seen again. In fact, I wanted to bring it to this, but I couldn't find it. So that kind of highlights a problem. It turns out that I'm not the only one who struggles with this, because compliance to home-based recovery exercises can be as low as 30 to 57%, and it dramatically decreases after about 2 weeks of last seeing your practitioner. And physical therapists recognize that patient compliance is a big problem. They try hard to make sure that their patients stay engaged, and the people that we asked about their experience with physical therapy said that they fully intended to do their exercises, but in retrospect, there's always a but, they did not end up doing them as much as they should have. And that's really why we want to introduce VirtualPhysio, which is a tool that empowers recovery practitioners with their own virtual assistant who, as an extension of themselves, continuously keeps engaging their patients and walks them through their recovery program day by day. So to show you how it works, imagine that I went to see my physical therapist for my lower back. Her name's Anna. And at the end of the session, she wants to give me some exercises to do at home. Now, instead of handing me a sheet of paper with instructions, the next day at a specified time, I receive a text message. And when I open it, there's a message from Anna. Hey, remember to do your exercises today. And when I click on this link right here, it takes me to a chat. And there she is, Anna from Advanced PT, or rather a virtual extension of Anna from Advanced PT, who helps me and walks me through my exercises for the day. So aside from reminding me and keeping me accountable to do my exercises, the virtual assistant sends me instructions for each exercise, along with a useful moving visual, which helps me a lot to do my exercises with the correct form and the right technique. And the virtual assistant also lets Anna create a more diverse and potentially more effective exercise program for me, which could include different exercises, different levels of intensity every day. And it also keeps it more dynamic for me because, as you can see, where applicable, it actually provides me with some choice of exercise at different stages of the exercise program. And when I go to follow-up sessions with Anna, her first question is always, hey, how have your exercises been going? And then I spend 5 minutes recounting my week since the last time that I saw her. But the virtual physical therapy assistant actually talks to me every day and gathers feedback about things like how I've been doing with my exercises, how my pain has been, and that could actually help Anna next time she comes into a session with me. She can be more informed, and she might already know some of the things about how I've been doing with my exercises that week. So if I know, I'll tap into that. So the business models we are considering are software as a service for recovery practitioners. So this includes physical therapists, but also occupational therapists, orthopedic surgeons, chiropractors. It can also be used as a tool for gathering data for clinical trials. And we also see an opportunity to partner with health insurance providers because if they can get their healthcare providers to use our tool, it should lead to better compliance for their patients with their recovery program. So to conclude, our virtual PT assistant will increase engagement from patients with their recovery program, which leads to improved results for the practitioners and also leads to faster recovery for the patients. Thank you very much for listening. If you have any questions, let me know. Yeah, right there.
So on the back end, I understand this is a text-based front-end application. On the back end, who loads all the pictures? How are they selected? How is that virtual
Great question. So what I didn't get to show you and what we're working on right now is the dashboard that we have for physical therapists. And the way that we really envision this is that it's truly an extension of your physical therapist. So once you go in and the physical therapist otherwise would either sit down and use their software that they currently use to print out a sheet of paper or even Xerox a textbook, which is apparently something that they do, they would now instead use that time to log into our tool and quickly select the exercises from our database that we would create for them. And there will also be, of course, ways to customize things and add their own exercises and things like that. Yes? Yeah, that's a great question. So that's actually part of what we would have to do as a business is to build up the content that would be provided on this platform. I think also that's part of where we think some of the value is. So if you saw the exercise images, they were, to me, that's probably the most useful part of this whole thing to help me do my exercises, and that's also where I think we can be useful. And creating those little GIFs shouldn't necessarily be a big investment on our side. Yes?
It would seem natural that the physical therapist, you would want them to be your salesperson, which means you've got to sell them. Is that where you're thinking about going? Or?
Well, the physical therapist has to pay for it. So they're the ones that end up paying for it. The customer simply gets to use this as a service when they go see their physical therapist, and that's also where we think our competitive edges. We're selling this to physical therapists with the idea that it not only helps them be more efficient with the way they work, and actually get better results out of their patients, which is how they get measured by insurance companies and things like that, but also as a way to actually keep engaging their patients and reduce the dropout level, because that's another thing that physical therapists struggle with is people that get disengaged with their physical therapy program and don't end up coming back. And this is a tool that keeps people engaged with their program and will reduce that rate, so it actually will affect their bottom line a little bit, where people will keep coming back. And next time you get injured, you will have had a great time with that physical therapist. You'll come back for that as well. Sure, over here.
What sort of pricing structure are you looking at?
Great question. So right now, we're probably going to keep it very simple, a fixed fee per month per practitioner, depending on the size of your clinic. But we're still very early stage. We're still working on our alpha test, as you can see. Again, if you want to be an alpha tester, we are looking for a handful of people to try this out. So feel free to take a quick snap of this slide and send me an email. We're looking for anybody that is currently going through physical therapy or other types of recovery programs that we can that's interested in trying this out for free. We're willing to work with you on that. So feel free to let me know. Any other questions I can answer? Right here.
How do you understand the behavior modification aspect, the psychology of getting people to have positive habits and putting that into the app?
That's sorry? So why don't you actually repeat the question? I don't think I can repeat it the same way.
I'm just looking at it from a human psychology point of view. How do you reinforce positive behaviors that people do inside the app to kind of personalize it?
Sure. That's a great question, and I think that's actually part of the challenge that we will face as a business going forward, to make sure that this is in fact a sort of a personalized tool that people want to use. I think it does sort of come down to what I said before, is that people do, when they leave the physical therapist's office, they tend to be motivated and they tend to want to do their exercises, and then they just forget. So it's not that people don't want to do it, it's rather that other things get in the way. And this is a useful tool that can help people be mindful and sort of offload the responsibility of having to keep track of it yourself. But that's a great question. I think going forward, that's something that we'll have to make sure we stay on top of in terms of our branding. Yeah, for sure. 45 seconds. Anybody else who wants to ask a question? Sure, right there.
Actually, I think this is a great tool because I'm thinking beyond physical therapy, there's a lot of this kind of teaching, learning environment that
Yep.
will benefit from this kind of tools. And basically, you can show how the action is achieved, and so there's a lot of can relate to a lot of different situations where the person take the class, after class, might want to revisit how that teaching is done.
Yes.
That's kind of like a broader application.
Oh yes, and it's great that you touch upon that, because those are verticals that we might explore going forward, to have additional product lines that have a similar concept but would work a little differently for different types of applications. So you can think of a lot of different things. Could even include maintenance reminders for your John Deere lawnmower. Hey, it's time to oil up your lawnmower. These are things that people tend to remember, and these are things that people tend to need instructions for, that they otherwise have to find online or go dust off that instruction manual that they buried somewhere in their collection. Okay. All right, that was it. Thank you very much for your attention. I appreciate it. Thank you.